Welcome, everybody, to the Greeley Healthcare Podcast. My name is Lisa Eddy. I'm a registered nurse and one of the advisory consultants for the Greeley Company. We're going to be talking again today about COVID-19, some more information for you. This morning, we have with us Bud Pate, who is the Vice President of Content and Development at the Greeley Company. Bud also has a very deep history with CMS and the state agencies, and I'll let him talk about that a little bit. But today, we bring this to you regarding this podcast regarding the new CMS waivers that have been allowed in relationship to what hospitals can waive in relationship to the regulations, the conditions of participation. So with that, I'll let Bud introduce himself, and then Bud, I have a few questions for you that I know our clients are going to want to be determining.
Thanks, Lisa, and it's nice being with you today. I'm like Lisa said, I'm Bud Pate, Vice President of Content for the Greeley Company, and I've been in this business about 45 years. 30 plus years ago, I joined Kaiser Permanente, having completed a tenure with the government where I was over all of the state licensing and Medicare, Medi-Cal certification inspections for acute care facilities in Los Angeles County. And so we've dealt with this kind of issue a lot before, and so I'm happy to bring whatever perspective I have to you, our audience.
Thanks, Bud. So one of the things we wanted to chat about were these 1135 waivers that CMS has been discussing. And if you don't mind, if you could just tell our audience what exactly is an 1135 Social Security Administration waiver?
So yeah, two parts. So first, what is a waiver? Well, a waiver, just like the name implies, means that in this case, for a temporary period of time, they are waiving the regulations or suspending the regulations. So that's what it means. Now, there are many, many different kinds and flavors of waivers that exist day to day. There are waivers that happen during normal times, but during national crises or national emergencies, the federal government can waive requirements for the conditions of participation, EMTALA, some reimbursement things, very broad authority under Section 1135 of the Social Security Act. These are called 1135 waivers, named after the section in the Social Security Act that allows those waivers. So again, 1135 waivers then are just good for the duration of the emergency. They can be backdated to when the emergency was declared by the President and the Secretary of Health and Human Services. And they will go on throughout the emergency until that declaration is rescinded, subject to 60-day renewals of these waivers. They'll be reevaluated every couple of months just to make sure these waivers are still necessary and appropriate.
Thanks, Bud. One of the questions I have, a very recent CMS update came out that sort of gave a more in-depth laundry list of the blanket waivers that are now allowed. Can you discuss that particular document a little bit and what the blanket waiver process versus requesting a specific waiver?
Well, as you suggest, pardon me, as you suggest, Lisa, there are two different kinds of 1135 waivers. There are blanket waivers, which means that you don't have to, no hospital, no healthcare entity needs to request a waiver. They're just automatic and they're given throughout the industry. No further request, no further action is needed. However, there is also a process to request specific waivers of specific regulations or processes that are not covered in the blanket waivers. So there's two kinds. So you need to understand what kind of blanket waiver exists, and then even if you need to do something that's contrary to the regulation that's not in the blanket waiver, that can be requested by submitting an email to the regional office.
Okay, I appreciate that, Bud. I know that you have put together a document that sort of discusses, and we're going to post that on our Greeley website, that discusses what are the issues that can be waived, how long the waiver lasts, and things of that nature. But could you just for a minute outline for our listeners when the state agency has to be notified?
Well, when you're requesting a facility-specific waiver or a waiver of something that's not covered under blanket waivers, that request has to also be submitted to the state agency. Those are the people in the state or the department within the state that does the CMS surveys for the government, for Health and Human Services. But remember that the states are much more heavily involved in making exceptions to existing rules than even the federal government. Yes, the federal government has flexibility, but all states also have huge authority. So for example, scope of practice, getting a license as a physician or a nurse, those are state by state regulations. And though Health and Human Services, one of its blanket waivers was to allow people who were not licensed in the state to practice based on a license in a different state or an expired license. Health and Human Services will allow that. That's really a state issue, and that assumes that the state has allowed that practice as well. So all of these sorts of operational waivers has to be coordinated with what the state is doing, because ultimately CMS would expect compliance with state and local laws, and so I think most of your practice waivers really need to start there at the state level. Now I know that, for example, in California, because everybody is in this mandated social separation of patients, of individuals within the state of California has issued an all facilities letter relaxing most of the normal licensing requirements during the emergency. And a lot of other states have done the same thing. But you really need to be considering not just CMS, but also any kind of state rules and following those first. And then when indicated, make sure that you complete the request for a waiver, or alternatively, make sure that whatever you're doing is in compliance or aligns with the blanket waiver we talked about earlier.
So one of the questions I have about that, so with just for my clarity, when there is a blanket waiver, meaning CMS says this particular issue is waived right now, so with the blanket waivers, does the hospital need to request, so CMS has already said it's okay, do they need to request a waiver of whatever issue falls under the blanket from the state?
Yeah, it depends on, the state may have also waived the same sort of requirement. So for example, in California, and we can go through in a little bit what the blanket waivers are as of the date of this recording, which is 1st of April. And it's a bit of a moving target, but we can go through those. But in the state of California, most of those things have already been waived. But you just have to make sure that you consider both sets of regulations, not just CMS, but also the state. And if there's no blanket waiver by the state that covers this, or if you haven't already gotten a waiver, then you have to align those and do this at the same time. Am I making sense?
Yeah, that's what I wanted to make sure, because I know hospitals were asking, geez, and thinking, geez, CMS says it's okay, then it's okay. Well, it may not be okay with the state. So what I think we're encouraging people to do is to double check your state regs and make sure that If you are falling under a blanket waiver from CMS that the state either allows it, as you pointed out, but with California, with the all facilities letter pretty much opening everything up, other states may not have that, and you might want to go ahead and check with your state to see if you need to submit a waiver for whatever CMS is blanketing. The other question that I had for you, Bud.
Well, yeah, just let me add something there. Yeah, well, when we do these things for our clients and process these things, that's the first thing we do is not only check with exactly what the situation is and what it is you think you need to be waived from, what requirement you think is over your head. So oftentimes there is no requirement that needs to be waived. You already comply with it, or you already comply with a blanket waiver. But what we always do is go to the state website and make sure those things are aligned. And it's a little bit tricky sometimes, but that's an important part of the process.
Right. Thanks, Bud. I know that we're in doing that, so that's something that was on my mind. The other issue I wanted to just make sure everybody was clear on is that the reason that we're asking organizations to be sure that they're aligned with individual waivers, blanket waivers, the state, is because when everything is said and done with COVID, there's an opportunity for there to be a look back by the regulators to see if, in fact, while you were sort of exempting yourself from, because of necessity, because of COVID, and an influx of patients and reduction in staff and so forth, that you sort of dotted your I's and crossed your T's from a regulatory standpoint. And that's why we're encouraging everybody to be proactive with waivers as necessary and to understand them well. But you did mention you're going to go over the things that are covered in the most recent CMS blanket waiver. But before you do that, I just want to, in keeping with what I was saying, can you just make sure that everybody understands the time frame for the waiver? So when you ask for a waiver, when does that clock start ticking? My question specifically is, does the clock start ticking when you exempted yourself from the regulation or when you request the waiver?
Well, the waiver can be either prospective, concurrent, or retrospective. So what I mean by that is that you can request a waiver of a regulation back to when emergency was declared. And it has to be declared by the President of the United States in order to activate Section 1135 of the Social Security Act, these kinds of waivers. And it also has to be declared by the Secretary of Health and Human Services. So you can go back to that date, which in this case, they're saying, and according to CMS, that date is March 1st of 2020, so a month ago. So if you've been out of compliance for the last month, they're allowing those waivers to go back to that date. And they can go forward through the duration of the emergency. Once the emergency is over, then the waiver is over. Now that's subject to review days, as I said before, so there is a bit of a period they're reevaluated every 60 days, but you don't have to test them every 60 days. It's just subject to reevaluation every 60 days. And on the blanket waivers as well, though we've already seen them change markedly, almost from day to day, as to what blanket waivers are out there. So what we recommend is just documenting exactly what it is you need to be waived from the predict. I mean, some things you can't predict, but to predict it, go ahead and request it through the regional office, and we're doing this for clients right now as we speak. And then you've gone on record that what you're doing is going to be allowed. It will expire when the emergency expires, but then so should the need. We assume that once the frequency of COVID-19 infections goes down, the emergency situation will continue for quite a while because we won't be operating under normal circumstances. So these waivers will probably are possible to go for that full time. However, important note is that if you don't need to be out of compliance with the regulation, the government would expect that you go back to your compliance status as soon as you possibly can.
Thanks for that, Bud. Just one question about that. Is there any kind of window? So let's say that they called, the national emergency is over, the president and the secretary both say, we announce it as of this date, the national emergency is over. Is there any window, because things don't happen at a pin drop at a hospital. Sometimes it takes a week or so to get back into compliance with something due to communication and a lot of various reasons. Is there any kind of window, or is your waiver over the minute that the national emergency is revoked?
Well, I mean, that's a good question. My understanding is, and it's just subject to anything can change, but my reading of the Social Security Act, which is that those waivers under 1135, that section, are only possible during these states of emergency. So hopefully when the director and the president decide to declare the emergency over, that they take into consideration it's going to take people some time to go ahead and go back and comply with things. However, when you think about going back and having if once you go back to normal, then you're in a compliant. You shouldn't need to use unlicensed physicians or nurses or other healthcare professionals. You shouldn't need to use temporary structures that may have been necessary to house patients. And so that's when the thing is over. Now you say, well, I've had privileges that have lapsed or expired. What do I do about those? A while to process those after the emergency is over. Well, that is something that we will be advising you is the best way to do this. But remember, during this emergency, the fact that these had expired or the preventive maintenance had not been done, you're exempted from that and you shouldn't have to worry about it. So there may be exceptions to that, but by and large, I don't see a problem at the end. But we'll stay tuned and we'll see what happens when this is all over. But we have a ways to go before we have to worry about that.
Yeah. So sort of in closing, Bud, would you mind just going over the list of blanket waivers of the various issues outlined in the latest CMS update about the variety of blanket waivers that we've got on the table now?
Yes, we'll be posting our summary of this, and this is a moving target, so I'll go through what it is today. This is the 1st of April. If you're looking for this on the web, the URL is rather long. It's at the CMS site, but the name of the document that really summarizes this is summary-covid-19-emergency-declaration-waivers.pdf. So summary COVID-19 emergency declaration waivers.pdf. If you put that in your Google search engine, you should be able to come up with the most recent version of this. But like I say, please visit the Greeley's website and pay attention to our podcasts and our blog posts. We will be also helping update these waivers. So with that, remember that a lot of the blanket waivers don't have anything to do with the conditions of participation, really. So for example, some of them have to do with provider enrollment or Medicaid. They also have to do with allowing a DRG exempt unit to house other kind of patients, things like that, that sort of are on the reimbursement side of things. So I'm not going to address those waivers. It's just the more regulatory compliance waivers. So just going briefly down the list, the site locations for screening under EMTALA, so that you don't actually have to complete the medical screening in order to direct people to an alternate location for screening. There are relaxations for verbal orders. The reporting requirements for restraint-related deaths. There's also a relief on the time frames for providing a copy of a medical record to patients. Also, patient visitation rights were those required under the conditions of participation have been relaxed a little bit, although the current regulation does allow flexibility. And also, there's a waiver regarding seclusion. So under restraint and seclusion, there is a waiver. There's a waiver about sterile compounding under USP 797 and the use of PPE. In other words, the reuse or the extension of use of PPE for sterile compounding under USP 797. The information at the time of discharge has been loosened. And other things about discharge planning. Discharge planning is not the normal, is often not the normal process, but they are giving some relaxation. They're allowing physicians to continue practicing even though their privileges at a hospital will expire. There are also medical records, waiving, about just in a general way, the medical records requirements. Also, the Self-Determination Act, the being informed about advanced directives and that sort of thing. There's flexibility there. Obviously, there's a huge flexibility on the physical environment, especially if you have to set up non-traditional places to house patients due to the surge. There is relaxation on telemedicine. Again, the licensing of physicians in the state, the provision of anesthesia services by CRNAs and other individuals who may be qualified to do it. Some of the normal supervision rules have been relaxed. Utilization review has been relaxed. Appraisal of emergencies at off-campus hospital departments has been relaxed. And things about the emergency preparedness plan, the COAPI program has been released. Nursing services, food and nutrition, respiratory care, and so forth. It's a rather long list. It's 25 pages, of which about 6 or 7 pages are pertinent. So I encourage you to go to this page. Even with the summary, though, the details of the waiver are not specified here. We have to do further digging. But this is a good place to start. Summary-COVID-19-emergency-declaration-waivers.pdf is the current name of the file, but we will be on top of this and doing analyses on our website. So please, Greeley.com, and we'll have updates as to exactly how what this means. However, just a word of warning, and just repeating something I said earlier, is that it's wise to get specific waivers for some of the things you're doing, even though there's broad waivers for nursing services, anesthesia services, supervision by a physician. I don't think I mentioned that. Not every patient now needs to be under the care of a physician, especially if in a surge. But you also have to remember that if you're not in crisis and you don't need to do that, then that waiver really is not going to apply. So even though it's a blanket waiver, it's conditioned on certain things within the waiver itself. So it's a moving target, it's tricky, and what we advise is being very careful as to how by requesting a specific approval for what you're specifically needing to do, or just a really detailed analysis to see whether that waiver or the regulations really pose a vulnerability for you. I know it's a bit complex, but hopefully, does that make sense, Lisa?
Yes, it does. And I did have one. I know I keep saying I have one last question. I have one last question, but the more you talk, the more questions I have. So one of the things that I think is important for our listeners to understand is when they do request this waiver, who would be sort of overseeing that allowance of that, or the request for the waiver from a leadership standpoint? So in other words, would you expect this request for waiver to go up through executive leadership? Does it need to go to the board? What's your advice on that?
Well, no, the request for the waiver does not need to go to the board. It's just all that's necessary is a contact person to get back to. But of course, the board and the chief executive are ultimately responsible for the actual practices that are the foundation or the basis for the waived conditions. So that is not or will not be waived, really, in my estimate. That the governing body retains ultimate responsibility, and the chief executive officer's responsibility for making sure that policies and procedures are appropriate. And I don't see waivers in that. I do think that there is going to be a lot of relaxation on the medical staff side, the organized medical staff. We see evidence of that in a couple of ways: attendance of patients by a physician, and even the needing of privileges. Although we have a podcast that you should check out on disaster privileges, we think that that's still an excellent idea. I mean, from not just CMS, but disaster. This is not that you don't have to privilege people, but we think that the disaster privileges process should be put in place. A long-winded way of saying that the actual request for the waiver does not need to go through the CEO, just a contact person, whoever is responsible for regulatory affairs at your organization would be fine, or anybody else that it could be an assistant administrator, anybody that you want to have do it. But ultimately, the accountability is at the governing body and chief executive officer level.
Thanks, Bud. I'll bring up one of my clients is requesting several waivers, and what they're doing. I mean, I understand that the individual that's actually doing it is the regulatory affairs person, but there's a list. There's already been discussions around we're not going to be in compliance with this condition. We're not going to be in compliance or this component from a condition element. And they're in the process of requesting the waiver. They're also sending a list of this is what we're doing. So there's good communication up through the executive leadership and ultimately to the board. They're just letting the board know this is what we've done, because things are moving so fast. You can't call a board meeting, you can't, things like that. But there is an expectation that there'll be good, solid communication. Would you agree with that?
Oh, absolutely. And remember that the CEO, if you look at the condition of participation, the chief executive officer is responsible for developing and implementing policies, and the board retains ultimate responsibility for the quality of care. So although the board is not going to be implementing the policies, the chief executive officer needs to be doing that and needs to be accountable to the board. And that's very well spelled out in the regulations. So I think not only is that a good idea, that would be expected and required.
Right. We don't want those things just happening in a specific department or in a vacuum. So even though things are changing very rapidly. So right. Thank you, Bud. We appreciate that in-depth discussion. Is there anything else you'd like to add?
No, other than my best wishes to all of our colleagues across the country. We hope that you are safe, and please feel free to reach out to us if there's anything you think we can help. We're doing our best to get this information out on our website for everybody to see, and we'll keep it updated as best we can. But it's rapidly changing, and so feel free to just contact us directly if you have a specific question.
Right, and so that all of you know, we are available and ready to help anybody that has any questions about how to fill out a waiver. If you'd like us, we are helping clients complete a waiver, file a waiver, check with the state, and there's lots of questions that are coming in about blanket waivers and versus specific waivers. So anybody out there that needs any help with that, feel free to contact us. We are able to get that process working for you. That's all we have for today. Thank you, everybody, for listening. Any questions or concerns, you can go to greeley.com. That's GREELEY.com.